So I am delighted to be able to moderate this panel of people with such expertise. As you know, this is Shaping a New Healthcare Workforce, this panel. And this is not a new topic, but one that has accelerated as many things did during COVID-19. I actually was on the board of Central Health, which is our healthcare district, for 8 years, and I was chair of the board of that for 2 years during COVID. And so these issues, I know, are very real. They were very real to us at Central Health and were accelerated during COVID as far as the workforce issues. But no matter what part of healthcare you're in, workforce is a big issue. And we also know that in this country, we have a gap when we talk about middle skill workers. And this is something that we've seen for years. And here in Austin for years, there was a study about 8 years ago, 7 or 8 years ago, right? But again, that accelerated during COVID-19. And when we say middle skill workforce, I think of that because a lot of the people who we think about in healthcare or the workforce of the future could be those middle skill workers. And those are people who need more than a high school education, but not a 4-year degree. So a certificate, an associate's degree, special training, and with more and more technology, I think there are more and more opportunities for jobs and really good jobs in healthcare and in the healthcare workforce. So we also know that we have some facets of our society who are aging, and that demographic presents some new opportunities, right? We could say challenges, but I'll say opportunities. And we also, of course, know and have heard about from the excellent panel that we just had that there are many inequities. And those inequities do come into play when we talk about workforce and the future of work and future workforce in healthcare. Those inequities are real as far as opportunities for people in the workforce. So we want to know what are the implications of all of these things? What are the challenges, yes, but opportunities for shaping a new healthcare workforce? And I am very pleased to have such an esteemed panel. We have in the middle Ryan Sutton. Dr. Sutton is a director with the Longhorn Center for Academic Excellence. Thank you for being here, Ryan. And to my right, Nina Amassi. Did I get that correct? Good. Dr. Amassi is Dean of Health Sciences at Austin Community College. And I actually have one of my research projects, we'll talk about it later, that I'm doing with some folks at ACC in welding because it's middle skill work. And of course we have with us Tamara Atkinson, who is CEO of Workforce Solutions Capital Area Workforce Board. So thank you all for taking time from your busy schedules to be here with us today. And whether it is education, which Ryan and Nina are involved in, or workforce development that Tamara is, you each are thinking about and cultivating the future healthcare workforce. So if each of you could take a moment to talk about, in your view, what are some of the skills that future healthcare workers will need? For example, I mentioned one, technology, but also data, analytics, changing nature of the workforce, race, ethnicity, language, diseases that we're seeing, social determinants of health, of course. So if each of you, we'll start here with you, Nina, could take just a moment to again, what are you thinking about? What is your view on some of the skills that future healthcare workers will need?
All right, thank you. And I just want to say I am so honored to be in such an amazing group of brilliance, and the theme that I'm getting is collaboration, 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 empowerment. So to answer your question, I would like to say the first skill that we need to ensure that our healthcare workforce is equipment is that empowered, that sense of empowerment to understand and advocate for not only their own role as a healthcare provider or professional, but also to advocate for the health of their patients. So we can go on and say the 21st century skills, you know, the communication, collaboration, absolutely. Those discipline-specific competencies, of course, are needed. But as you mentioned, also those digital and technology skills, our future healthcare workforce, it's upon us as a collective to equip them with all of these to better serve our community and to lead to the health of our community.
Thank you. Ryan?
Thank you. I'm going to go ahead and build off of that. The first one I was thinking about was the skill set of cultural humility and leveling the playing field, if you will, when we start talking about health and the health landscape. In what ways are we continuously pushing ourselves to learn, be introspective, and grow, understanding those that we're serving, but then also having the space for the community's voice to not only be heard, but to actually take heed to what the community is saying, to actually drive the direction in which we're going in health. Without that, I think we end up becoming very stagnant with where we are within health and healthcare development, and we're not necessarily growing. And to that end, right, whereas, as you mentioned, these other fields, engineering and so forth, in what ways are we bringing a health equity lens to these other fields like engineering? We already know that the algorithms are set up in ways that prevent people of color from getting the treatment that they need. So how is the community being on the onset or the outset of developing the algorithms and the technologies and so forth that are going to guide the way that we practice and we engage the community in treatment and prognosis and so forth. So I think that cultural humility from our direct engagement, our direct service to understanding health equity within technology and so forth. The last thing I'll add on to that is how are we training our future workforce to be interdisciplinary, collaborative? Because as we see, there's more fields that are entering the health space than we typically have had before. And what's going to be lost on us is the way we communicate with each other and the way we engage each other in order for the outcome of the patient or the community to really be enhanced. So without that skill set, when we still have a medical hierarchy, where people are serving on certain roles or people's voices may not be heard or community might be off to the side, it might limit how we move forward. So that would be another.
Thank you. Tamara?
So I love what my co-panelist just said, that interdisciplinary collaboration. I think that that's brilliant, and I think that's exactly right. To answer the question, Sherry, I'll say I'm going to date myself and use myself as an example. I actually went to UT, graduated from UT in the early 90s, and I actually erroneously thought that once I finished my formal education, I was done learning. I thought, I've done it, I've made it, I'm out, thank goodness. And I moved on. Well, what we're seeing now, whether it's healthcare or other targeted industries, is you never really stop learning. And that has never been more true than in healthcare in particular. There has got to be a skill around continuous learning, continuous lifelong learning. But I also want to add, and I want to bring what Nina said into this conversation, and there should be a level of empowerment and self-advocacy, self-efficacy in the work that the healthcare workers need to feel empowered to speak up for themselves and ask for what they need when it comes to lifelong learning. It should not be only on the shoulders of the workers who are carrying significant loads. There must be a partnership with their employers. And so the workers should be able to ask for what they need to continue to learn. And then the employers, I believe, should pay them to learn those skills and continue to advance their skills on the job. It's a value, it's a win-win, and it's a value add for both parties.
Thank you very much. I certainly heard some themes here of empowerment and collaboration, interdisciplinary, which is what IC Squared is all about. And I'm a professor at the LBJ School of Public Affairs, and just by the nature of a School of Public Affairs, we're very interdisciplinary. So I certainly appreciate that. Equity, of course, and then the lifelong learning. As I like to say, you start learning the day you're born and you stop the day that you are no longer with us on this earth. But I think that those are very important points. And Ryan, you brought up algorithms, and certainly with artificial intelligence, which I think we're all hearing about daily, in fact, by the moment, we know that the AI, the artificial intelligence, the AI is only as good as or bad as to what's fed into the algorithms. And we know about the bias in the algorithm. So I thought that was a very important point to bring up as we're thinking about technology. Brian, I want to talk more about diversity and equity with each of you. Those are key themes in this conference. So Ryan, I wonder if you would start by talking about programs that you've been developing to extend and expand the talent pipeline that feeds into medical school and to other healthcare related programs in this healthcare ecosystem space, because we do want to expand that workforce.
The Office of Diversity, Equity, and Inclusion at Del Med has been doing some great programming around pathway development led by Liliana Martinez. We have high school summer camps. We have a high school year-long program. We have a general chemistry summer camp for those entering college. But the idea around all of these is creating access, exposure, and opportunity. How are you creating access, exposure, and opportunity for students who typically may not have those ends in order to understand what are the roads that are laid out in front of them, to demystify the spaces or the professions that they might be dreaming about or thinking about, and to allow them to re-envision themselves or envision themselves in these spaces, in these positions. So when we talk about the high school summer camp, Lily does a phenomenal job in creating opportunities for them to hear from physicians, dietitians, nurses, engage in dissections, sonograms, to learning how to take vitals. And I think the more we expose students to this, they start to understand not only this is something that I can do, not only this is something that I want to do, but this is something that was made for me. That I have a place of belongingness and inclusion within this work, and I'm hearing the stories of people who look like me that go forth. I think the other thing that we end up doing is looking at the pre-health, pre-med population and what kind of access, exposure, and opportunity we're providing for them. So in partnership with the Division of Diversity and Community Engagement, we've started creating exposure programs for these students. Last year was the first year. Next month will be the second time. We're taking the students out to Atlanta. They're meeting with the CDC. They're meeting with the Satcher Health Leadership Institute at Morehouse School of Medicine. They're meeting with the Atlanta Hawks sports medicine staff. So we're putting them in places to have meaningful conversation in ways that most people don't typically get. And what do you think that does for the personal and professional self-narrative of a student when they enter a space and said, I saw the CDC on the news, but I never thought I could end up there, to sitting in a seat talking to executive leadership in that space. So really, how are we creating opportunities for access and exposure in a way that can help them transform the way they view themselves, they view the industry, and they view their engagement with them?
So, Ryan, why do you think that it's important to have equity and really, why is it important to have diversity of the workforce in healthcare?
We could go on and on about that.
I know we could. I know this is dangerous. So,
right.
so we'll get each of you will get an opportunity to answer this question.
I'll keep it short. I think we've seen enough research that shows that the more that we have a healthcare profession that looks like the population that we serve, the prognosis and outcomes are way better. We understand that when we have, appreciate that. When we have a population that looks like when we have a healthcare population that looks like the community that we're serving, it empowers the community as well to speak up and advocate in there. Complex medical decisions are made more creatively and more effectively and efficiently with diversity. The list goes on and on and on of why it's important. But I think also at the end of the day that when we have more diversity of lived experience in there as well, we understand those social determinants of health at another level that brings in a broader and more holistic way of thinking of how we're doing problem solving when it comes to treating the community.
Thank you, Ryan. So, Tamara, can you describe how your programs are working to diversify the talent pipeline in healthcare, and also why you think diversity in that workforce is important?
Sure. Well, the answer to how we're diversifying the talent pipeline is a big I could go on and on, sharing, take up our whole time. So let me just start by setting some context. Workforce Solutions Capillaria, the organization that I help lead, we believe in supporting and connecting local people to local jobs. And so what we're doing is we're looking at targeted industries. Healthcare is top of that list, and we are intentionally, unapologetically preparing and supporting local people to go into local jobs. Now, when we look at healthcare in the Austin Metro's area is the only targeted industry that we support that is dominated by women. All the others are male dominated. This means women are benefiting from quality jobs when they have a level of post-secondary education, such as a registered nurse or above, and we're happy to work with NINA and ACC. But, and this is where I pause a little when we talk about inclusion and equity, the entry-level jobs in healthcare, so the hospital healthcare support jobs pay $13.62 an hour. And so it's primarily female-oriented industry where the predominance of entry-level jobs don't pay a wage that allows someone to afford to live in Austin. You compound that, and this is also an equity answer, you compound that with the lack of childcare and the lack of childcare at the hours that the healthcare systems are operating. And what we are doing is we are building a healthcare system on the shoulders of primary caretakers in many cases without offering them the level of supports that they need to be successful. So what is Workforce Solutions doing about it? I'll just give you some high level. We are working actively to expand the availability and access to childcare. Every single day in this community, over 3,200 children receive subsidized care as a result of what our organization is doing in this community. And we are looking to expand that. We know that infant care is the most critical part of early childhood education that's missing. Fewer than 1,000 kids a year are able to receive, infants a year are able to receive this subsidy. So that is a large number of new families that can't have access to childcare, and that's going to impede our ability to recruit healthcare. Second, what we're doing is and Sherry, maybe later I can talk about this more, we're working more and more with the schools to allow students opportunities to work in healthcare through internships, apprenticeships, and others to help out the employers who are desperate for workers. Right. Just headline, in March, we had over 10,000 open healthcare jobs in this community. Over 10,000 healthcare jobs just in Austin Metro alone. So we are working with employers to help them be creative in finding their future workforce and helping these workers get some early experience and college credit while they go through the process.
Thank you. And yes, certainly childcare is, I think, really the starting point for just about everything in the workforce, right? Having at one time had young children myself, you know, it's very difficult. And at the wages that you just described, we know it is impossible, absolutely impossible. So thank you for bringing that to the forefront. And Nina, same question. You know, how are your programs working to diversify the talent pipeline in healthcare, your programs at ACC, and your perspective on why diversity in the healthcare workforce is important?
I think exactly what Ryan mentioned, and when we talk about health equity, when we talk about addressing the disparities, we have to have a healthcare workforce that represents the patients that we serve. Without it, we can't have another discussion, and they're not separate from one another. Healthcare workforce and healthcare workforce education are one, and it requires collaboration. I cannot stress that enough. So I can speak a little bit about ACC, not that ACC and UT are competing, but I would love to share a little bit about the great work that ACC is doing in the area of diversity, equity, and inclusion through our remarkable DEI office and the work that the faculty are doing. As a whole, ACC, we have annual 70,000 students, many students in high school, dual credit programs, adult education programs. We have many fast-track programs, 100 basically programs in 10 areas of study, including health sciences. In health sciences, we have 14 credit programs. I always say, not counting physicians, we can basically staff a hospital. I don't know if you guys knew that. From radiology technology to occupational therapy assistant, physical therapy, sonography, nursing, of course, dental hygiene, vet tech. We have a slew of incredible, high quality and affordable programs, and the college is laser focused on actually equity, instilling equitable learning and teaching practices and one of the goals is to diversify the workforce. At the end of the day, for a community college, and by the way, community colleges do incredible work in the community in preparing the future workforce, not just in healthcare. But so when we talk about the equity and student success, the work that ACC has done is several-fold. And one is, I can give some examples of the grants that our health sciences is involved with to diversify the nursing pipeline through an Achieving the Dream grant that we have been blessed to have, that has helped us increase the pipeline, diversify the nursing program demographics through a partnership with Capital Idea. We have received another HCA healthcare grant that we have partnered with 2 local school districts, Manor and Austin ISD, and we are encouraging, inspiring high school students from minoritized and underserved areas to explore our programs. And we're thinking big, we're not limiting. We want them to dream big. If they want to become a neurosurgeon, we are just the gateway to that. So using grants, using partnerships. Another thing that we're doing at ACC is focusing on equity and hiring. Without a diversified faculty, we cannot have a successful effort to diversify our healthcare workforce, or any workforce for that matter. So ACC has embarked on a multi-pronged approach to diversify the faculty and equip the faculty with equity mindedness through our Teaching and Learning Excellence Division, TLED, has created phenomenal workshops, seminars, and modules, if you will, to allow faculty to learn more or, become familiar with that cultural humility, cultural capital, having that asset and strength-based perspective when we serve our students from different walks of life. So to me, creating an equitable healthcare workforce, it's so big, and I can still go on. I apologize.
You talked about just now students from different walks of life. Are there any trends you're seeing right now among students? You have a very diverse student body. Are there trends among the types of students, the age of students? I know that ACC is really a critical resource in this community, for instance, for individuals looking to make a career change, right? And some of them are older and maybe make a career change into healthcare. Are you seeing any trends?
I would say the common trend that I see in our students is that they are extremely dedicated and hard workers. And they come to us. The average age, I would say, is 28. We have, students from different backgrounds. The majority work. Many have family responsibilities. They might be a single parent. In our health science programs, the majority work and they're enrolled in our full-time programs. And many of them work as you mentioned, essential workers within healthcare. So we have a major responsibility to serve those students well. And that's why wraparound support, those partnerships in the community that we have, as Tamara mentioned, the apprenticeships that we do, internships, that those earn and learn opportunities. We're focusing a lot on on stackable credentials, pathways for
So
our
important for those middle skilled workers, right?
Absolutely. So that it makes sense for our students to pursue education, right? Economically, it has to make sense for them, as you mentioned. If they're gonna, we need surgical technologists, for example. We need dental hygienists. We know we need nurses. But in order to encourage folks to apply for our programs, they want to know, okay, when I graduate, what is going to be my starting salary? So that is why this has to be collaborative. We can't do this alone. Recruitment is part of the effort.
So, speaking of collaboration, Ryan, what trends are you seeing among students?
I would say two particular. One, we're seeing more students coming with a dedication and passion based on their lived experiences. We're seeing a lot of students. I was serving, not me, but I was serving as an interpreter for my parents and my grandparents at at doctor visits, some of a young age. So I started understanding the need and the importance of this, or the complications it was navigating a system where you didn't speak the same language. Or I was giving Big Mama her insulin shots for the sugar since I was 8. And I know how to do that, and it's something that's just natural to me. And now I'm conceptualizing my whole experience and my whole upbringing in a way that says, this is a field I want to go into, not only to be part of the field, but to change the field. And I'm seeing we're having more and more students come with the passion of, I want to change this because I know what I experienced in my community was not right. So I think we're seeing a lot of that. I think the other thing that I'm seeing is a number of students who are coming forward, understanding that direct service is not the only route into health. So I'm getting more business majors knocking on the door. I'm getting more policy majors knocking on the door. I'm getting more majors that are not necessarily within the sciences knocking on the door, understanding that my role here and the impact that I can have on the system and the structure, and we start talking about structural racism and structural oppression that happens within health, I want to impact that, and there's other avenues in which I go. They're coming, I would say, a little bit more awoken than we have in the past, knowing there's other ways of engaging with this field and having an impact.
So I'm hearing you speak about change, which we're certainly seeing, and the passion and the different careers, whether it's business or policy, or the more traditional biology and sciences. And I also heard something that I think many have experienced, and you started off talking about empowerment, and that is the person who is seeking the medical care, right? Empowering them. You spoke about your experiences, and it brought back to my memory a time when my mother was quite ill. She had cancer, and my parents were in Oklahoma, but she was being treated at MD Anderson, as a matter of fact. And after the first couple visits, I realized that my mother and father just their experience with healthcare was not one where they felt that they had a role in their own healthcare, right? It's just you go, you're told something, and you leave. And so I realized that, I said to my brother at the time, okay, one of us has to always go with them, right? So that questions are asked and there is some empowerment, and so I think that change that you talked about and that passion is really important. Tamara, you bring unique experience, of course, in the workforce development space. Are there workforce issues, challenges, or opportunities, unique to healthcare jobs? What trends are you seeing, and what programs are you developing to get ahead of things in healthcare specifically? For instance, how are you thinking about upskilling and, again, the middle skill worker?
Sure. So I'd like to talk a little bit also building off what Nina and Ryan were saying about trends that we're seeing. We are seeing fewer and fewer students and workers that we serve having the luxury, and I'm going to call it a luxury, of only pursuing post-secondary education without working. When we talk about equity, people need money. They've got real costs, and so we're seeing a trend that is pushing us in a positive direction to offer a variety of earn and learn opportunities for our students, and that is also allowing us to benefit our employer community that are looking for the skilled workers. So, Sherry, just to build on what you're asking about and what we're seeing, we have really in the last few years leaned into the apprenticeship programs for in-demand healthcare shortages. I will say I've been in the business, a workforce professional for more than 2 decades. And if you had asked me even 5 years ago whether the healthcare industry would embrace apprenticeship, which has traditionally been in the skilled trades construction area primarily, I would have kind of laughed. I'd say, I don't know if healthcare is really going to be set up that way. And I've seen the changes come in part because of business need, in part because of what workers are asking for. So I am proud that since 2022, Workforce Solutions has helped train 147 apprentices in certified medical assistant and patient care tech. Now, these are entry-level positions, we know, but for many individuals, they're coming from environmental services, they're coming from hospitality, restaurant, other industries, and as a result of COVID, in part, they're saying, I want to move into an industry where I have career growth. And so the trend that we're really seeing and what we're excited to be supporting is over $1.5 million under management through our organization alone to support the expansion of healthcare apprenticeship. We're doing it in great part with Austin Community College as the educator. And what I love about the partnership with ACC is that the instructors go on site to the healthcare system's place of business so that talk about access for the workers can receive their instruction right there on site at their employer and be paid by their employers for the hours that they are in training. I think that's one of the most innovative and exciting advances that has come to workforce development.
Well, and it's worker and human centered. Yes. Very, very exciting. We've had a robust discussion about healthcare workforce and various facets, but what I'd like to hear from each of you now is what's your vision of the future of the healthcare workforce? How would it look different from today's workforce? What can we do in a concrete way then to shape your vision? And we'll just start right here.
I'll start with the second part of your question. What can we do? Collaboration. Again, I cannot stress that enough. When we talk about preparing the workforce, and right now we're at a critical period, right? We have critical shortage of various healthcare, professionals, not to mention nursing, dental hygienists. I mean, the list goes on, physicians. We have the challenge of recruiting qualified faculty, retaining, those salary differences from clinical practice to becoming an educator. We can say as educators that it's the passion, but we have to live. I mean, Austin is expensive. So if we want more healthcare professionals, we need more faculty. So this is huge. The National Academy of Medicine last October published the National Plan for the Health Workforce Wellbeing. It's a pretty comprehensive read. I encourage you to look at it. And they make several priority calls that includes diversifying the workforce. It includes focus on well-being, focus on the digital technology resources. So it's, again, we need all of us to put our brains together to make policy change, to find funding sources, to recruit faculty, to encourage folks to pursue health careers that they can live in Austin if they're going to work in a hospital as a technologist and they have to be close to the hospital. Well, then with that salary, can I live in Austin? So it's a partnership with all of the stakeholders, including community organizations, Central Health. I mean, it goes on and on. I'm sorry. I can go on and on.
And when you talk about living wage, let's, the historical perspective. Why are certain occupations historically so low as far as wages, and what are they? Well, let's see. There was a time when there were only, I'm thinking of 3 particular occupations that women could hold outside the home, right? One was being a teacher. Pay scale's really low there. What's the next? Healthcare, pay scale's pretty low. And there was a third. What was that? Yes. Well, is there a theme here? So, yes, I think that there are historical, systemic, yes, issues as far as living wage. There's no doubt about that. But, you know, you've also pointed out that we have a labor shortage. Try to get an appointment with your dentist just to have your teeth cleaned, right? Or some other areas. And you think, well, we have openings. We have a labor shortage. Why aren't people filling these jobs? Well, maybe it's because they can't actually survive. Yeah. Maybe it's because we don't have housing for them that's actually, you know, close to where they'd be working. Maybe they don't have cars. Maybe they need to be in walking distance. So, you know, you brought up very important issues. Ryan, the same question here. What's your future vision of the healthcare workforce, and how would it look different from today's workforce? And what can we do in a concrete way? What one thing could we do to make your vision come true?
The first thing I'll start with is going back to the earlier point of having a healthcare workforce that's reflective of that of the community. And when I say that, I'm not just talking about recruitment or the workforce of the future. I'm talking about what are we doing in the current climate now to retain what we do have, because it makes no sense to recruit people into a field or a climate that cannot sustain them, or to bring people into a climate, excuse my voice, bring people into a climate that might be hostile or problematic for them. So what are we doing now to shift the climate of the healthcare field in a way that is welcoming and encouraging and is ready to have individuals, you know, underrepresented, first gen, low, under-resourced to thrive in these settings, right? So I think that would be the first thing. The second thing I would look at is how we operating as a field of health in general to be more empowering and egalitarian towards the communities that we're working with. What are those models that we need to shift to? Are we looking at things like the Cherokee health models in Tennessee and how they operate? Are we looking at things like the Nunca health systems up into the Washington area and how those indigenous practices are working in order to say, hey, you know what, when we have a session, we're all coming in and we're sitting in a circle. There's no behind the desk. There's no hierarchy here. And we have equal voice in how we talk about the prognosis, how we talk about the treatment. We have an understanding of how we're reaching into community and bringing in relevant community members and pertinent community members to be central in the conversation as we talk about this individual, and have we really structured this individual and their family to be experts within this field? Has our health field created room for all of this work? So when we start talking about we want to diversify our workforce, that's great. But if it's just walking through in people through the door, that back door is probably right after it. So I think these are some of the things that we need to sit down and grapple with ourselves before we just completely run out there and try to pull everybody into a system that's not really set to handle them without preventing them. We do want them to come in, but we have to work on this.
Yeah, and that's a great point. You don't really have a workforce if what you have is just a churn, right? You train people, they come in, you get them trained, they're there for a few minutes, they leave, and you start all over again. Absolutely, Ryan. And Tamara, same question for you. What's your vision of the future healthcare workforce? How would it look different? And what's one thing we could do to make that vision come true?
Sure. So I'd like to set the context for how I'm going to answer that. And that is to give you some data. The Texas Workforce Commission expects the demand for all healthcare occupations is going to grow faster than all other occupations combined. So we already have here in Austin 10,000 healthcare job openings from registered nurses to entry level open. It's only going to grow. It's going to grow by over 23.9% to over 298,000 healthcare workers in the state of Texas. So this is an issue that we can't be the ostrich and hide our head in the stand and believe this is just going to go away. So my vision for the future is in line with a research study that I read in 2021 by Jobs for the Future, JFF. They called it the big blur. What did that mean? The big blur meant that we have got to stop segregating our education system into you only learn this at this age, you only learn this at this age, and in these grades, and so on. There has to be a merging, a blending, starting in elementary school, of awareness about the range, the myriad of jobs that are available in healthcare. There's got to be ways for students and teachers, let's support these teachers too, to really understand that. And then we have to educate our employers. They have to be part of the solution. One of the things, I'll just say it, that sticks in my craw a little bit is when employers expect to have that talent show up at their door and not think that they can just hire that talent without putting some skin in the game. I think a healthy system, a system of the future, has employers equally participating along with traditional educators, along with non-traditional educators, along with school systems. So how are we starting that here in Austin? How are we starting that? Well, what we are seeing is that we are working with employers who are becoming increasingly creative in bringing in their future workforce. For example, hospital employers are now recruiting nursing students for internships and paying them to fill patient care technician jobs and other roles while they receive their training. So they're giving them that earn and learn opportunity. The students are able to count those work hours toward their clinical hours needed for graduation. And then the employers are hiring those interns upon full-time completion of training. That is moving toward that big blur, that seeing our education system not as so sequential and lockstep, but really a continuum. Similarly, I will say that we're also seeing the hiring of graduating high school students as an opportunity to start to blend that. We are seeing that this year alone, for example, all 3 of Austin's major hospital systems have offered an interview day for senior students in the region. Over 330 graduating seniors who had taken healthcare in their CTE programming, so while they were in high school, they attended the events, with many being offered jobs right there on the spot, and others being scheduled for second-round interviews and shadowing interviews. So we're seeing employers increasingly reach down into the schools, and we're seeing the schools respond.
So we need to start educating children when they're very young and continue that, right? We have to have that continuum. And something that all of you have said, and we'll end on this note, is that everyone, this has to be a collaboration, a partnership. Everyone must participate, and that includes employers. So I know you all have some questions, and we've saved some time. With that, we'll open up to your questions. I see one in the back here.
Yeah, so I guess this question.
Hold on one second.
Oh, I'm so sorry.
No.
Oh, no. Thank you. So I guess this question is for Ryan. I'm wondering how optimistic you feel right now, kind of looking over, you know, I'm a Gen Xer, and, you know, back in the 80s, seeing some of the male physicians I knew, watching some guys, dad and peers, go through medical school. It was predominantly male, white, an authoritarian structure, like a boot camp almost, survival of the fittest. How far have we come from that old model?
I don't have my ruler on me. I'm not quite sure how far we come. I do think there has been some progress. You know, for example, I'm a Jesus Ortega, right back here, director of the office, has been running a phenomenal change agent program that works with every department, every division, has just paired up with social work, pharmacy, athletics, and nursing. And some of the changes in mentalities and thought processes of physicians, of faculty members, of staff, even through that program, and seeing the efforts that are still a ways to go, but the willingness to explore and unpack and question and interrogate how and why we're doing things, we're definitely seeing that happening. I still think we have a ways to go, and we still have to see this develop out and to manifest into systems change. But I do feel optimistic about where we're headed. I do think there's a lot of questioning in terms of the core structure of how we operate that we have to get to unpack. That might take a little bit more time, but at least at the surface level, if you'll say, I do think people are starting to question and unpack. And I think part of the reason what the climate we're seeing now is because they've noted things have started changing. And let's run it back, right? So as frustrating as this time is, and I'll just speak to it, as frustrating as this time is, I also have to hold on that bit of optimism of there has been progress, and that's what has people shaking a little bit. So let's keep driving. Let's keep pushing this down. Let's use this time to figure out how do we deepen the work and really integrate it into the fabric of our institutions in a way that you can't pull it apart as an auxiliary thing, to keep this driving force. And through things like the CAP agent program and working directly with the departments to infuse it with people, I think that's the way to go. So as frustrating I might be right now, there is still that hope of optimism in where we're going.
Thank you. See, several questions. We'll maybe start here and just move along this arc here.
So I'm curious, as you've talked about shortages in workforce, what you foresee as the impact of artificial intelligence on this profession, and also what are you doing to train the students in your area in terms of being prepared and understanding AI? Do you see it as a threat or as an opportunity?
I am no expert in that field. I have to put that disclaimer out, but
I can help with this one in a minute.
yeah, but we are aware, and ACC is looking at it as an opportunity. I had the privilege of attending the colloquium that IC Squared had on the topic, its impact on healthcare and the ethical consideration. So certainly it's something that is on our radar. We understand the impact that it already has, and we are looking at ways to either leverage it or, work with it, address it. It depends on which aspect you're looking. But I know it's way, way vaster than I can even address right now.
As it happens, I have been part for several years of an interdisciplinary, multidisciplinary research collaboration here, one of the three Bridging Barriers challenges, called Good Systems, and Craig has also been involved. And Good Systems is specifically focused on artificial intelligence and how can you use it for good and in ethical ways and keep the human in the center. I'll actually become chair of this in August. So we are very focused on all aspects, but one that certainly has come to light lately is, what does this mean? Last year I actually focused on AI and the future of work. And so we know and have known for a while that there are certain positions in the workforce that probably will not be around, right? But there are others that we will need. And I think that goes for healthcare too. And that there are some ways in which AI can do good, and some ways in which we've talked about with bias and algorithms bad. But good would be, we've seen situations in healthcare where using artificial intelligence, right, researchers and doctors have been able to figure out a disease that someone had that they never would have been able to figure out otherwise, right? So going through an amount of data, right, for something that is perhaps one of those kind of unicorn diseases. So that would be an example. Or finding treatments. On the other hand, there certainly are concerns not just about privacy, but about equity and about algorithms. But I think as far as the workforce, you will see some jobs that are on the downward slope, but you will see others that are increasing, particularly those that are involving technology, involving analysis, and we could have a whole nother discussion, I know you did, about generative artificial intelligence, right, ChatGPT, and what does that mean? As an educator, I would say that two things. One, we have had many industrial revolutions, right? And we've had changes in teaching that we've had to adapt with, including, laptops and online. And so I think one way is to think, how can we include this and have students use it as a tool to do better research, for instance. And then on the other side, you may be seeing more tests that are the old blue book with a pen style. I think we had another question here. Did you all want to address AI? No. Okay. I saw another. Yes.
Thank you. So, I got to thinking about, while there are lots of shortages in healthcare, like clinicians and things, there are some data that are shown where there is a certain segment of the healthcare workforce that is exponentially increasing, and that is healthcare administrators. And they tend to make a lot of money, and I'm wondering how we equalize. On that same graph, you'll see clinicians kind of almost going down, and I think the graph is actually physicians. But we need to equalize that, because that's a lot of money and value that I think is not additive to what we need to accomplish. I'm curious how you all might think about how do we, get that gap narrowed a little bit more.
So what do you think?
We need healthcare professionals on boards. We have a national initiative, nurses on boards. We literally need to, again, empower, no matter what level of education, what they need to be informed of how critical it is that they have a say at the table, and and it's on us as educators, as, community stakeholders to, again, empower them and lift them up, give them the voice, give them the tools, the information, right? And kind of create a policy medium that it looks at that it does look at that.
Tamara.
Thank you. I would say demystify the career pathway. I think if students don't know how to get there to become a healthcare administrator, they're less likely to ask for and advocate for themselves or advocate for experiences. So healthcare, the beauty about working and supporting healthcare as a workforce, targeted workforce industry, is from entry level through nurses, at least in the middle skill space, it's pretty well articulated what you need to learn, where you go to school, how you have experiences. But beyond that, I think it's not always clear how one can become an administrator. So demystifying that pathway and having leaders who are currently in those positions share their stories about what experiences did they have that allowed them to then advance to those positions. So we need more people on boards, as Nina said, more people telling the story about here's how you can advance. And then we need to articulate that better in terms of what we're sharing in the schools, what we're sharing with teachers, what we're sharing with all the support industry that is supporting particularly low-income students to understand what their pathways are.
A big thank you to our panelists. What an amazing discussion.